What makes narcissism and psychopathy, particularly the behaviors and traits of narcissism and psychopathy, so distinct from other mental health conditions? What previous researchers like Miller have noted is that narcissism and psychopathy tend to be one of the few conditions where the person causes more harm and distress to the people around them and experiences less distress to themselves due to the nature of these traits and behaviors, which tend to be egocentric and is aligned with their character, their core values, their goals in life. They tend to be very grandiose. They tend to lack empathy for others. Some of them lack remorse. Some of them lack affective empathy, but still use cognitive empathy in order to weaponize their assessment and understanding of other people's desires and fears and traumas in order to use that against them as ammunition and manipulate them further. And what we're seeing with narcissistic traits, specifically in research, is that, for example, in a meta-analysis of over 437 studies, narcissistic traits were associated with both unprovoked aggression and reactive aggression and multiple forms of bullying. And other studies signify that this could be related to a narcissist's need for power and control over others. And it does show a level of egocentric fulfillment. And this is, again, very different and distinct from other mental health conditions. For example, the uncontrollable OCD compulsions and intrusive thoughts that people with OCD suffer from, or the auditory and visual hallucinations that people from conditions like schizophrenia might suffer from. Because much of their aggression and bullying is directed by behaviors and feelings like malicious envy, as also shown in other studies. And that is driven by a need to control others, to relieve ego threat, and whether the aggression is reactive to a perceived slight or unprovoked and premeditated, it is used to harm others actively to reach their goals. And that is aligned with their core values and their identity of someone who is grandiose, who wants to feel superior to others, who wants to harm others for their own gain, and lacks the empathy or even the remorse if they're psychopathic to care about the impact that it has. In some cases, if they are psychopathic, in addition to being narcissistic, they may even gain sadistic pleasure out of harming others, out of engaging in gratuitous violence. And both types of violence, instrumental, premeditated violence, and reactive aggression, can have that ego fulfillment, that egocentric agenda. Now, people will wonder, well, didn't narcissistic and psychopathic people all suffer childhood bullying or childhood maltreatment from their parents when they were young? I mean, isn't that why they are the way they are? So they do suffer some sort of distress? And that's not always true. In fact, what research is showing is quite the opposite. For narcissistic traits, we're seeing that parental overvaluation in longitudinal studies is actually what strongly predicts narcissistic traits, not childhood maltreatment. That doesn't mean that all narcissists are the same or that they don't have histories of childhood trauma. Some of them may, in fact, have those histories, but no more than anybody else who has non-narcissistic traits. So it's not something that predicts their narcissistic traits necessarily. It's actually spoiling them, overvaluing them, teaching them that they're superior, that could cause narcissistic traits. As for psychopathic traits, there are two subtypes of psychopathy. And primary psychopaths, the people who are born, said to be born rather than made, of course, there's always going to be a combination of nature and nurture, they have a biological predisposition to psychopathic traits. They also report less childhood trauma, they have fewer post-traumatic symptoms, and they tend to have less psychological